What if a simple cup of rosemary tea, something many people ignore in the kitchen, could quietly support your digestion, your memory, your circulation, your blood sugar balance, your liver, your skin, and even the way your body handles stress? Most people look at rosemary as nothing more than a fragrant herb used to flavor food. But behind that powerful aroma, there are natural compounds that have been studied for their antioxidant, anti-inflammatory, digestive, and protective properties. And here is the surprising part. Drinking rosemary tea every day may not feel dramatic at first. There is no loud sign, no instant miracle, no sudden transformation overnight. But inside your body, small changes may begin to happen, especially when this habit is combined with a balanced diet, movement, hydration, and medical guidance when needed. So before you drink another cup of tea without thinking, stay with me until the end, because rosemary can be helpful for some people, but it can also be risky for others if used the wrong way. 1. Rosemary tea may help support better blood sugar balance. One of the most interesting reasons people talk about rosemary tea is its possible effect on blood sugar balance. Blood sugar is not only important for people with diabetes. It matters for energy, mood, cravings, weight control, sleep quality, and long-term health. When blood sugar rises too quickly and falls too sharply, the body may feel tired, hungry, irritated, or mentally foggy. Over time, poor blood sugar control can become a serious concern, especially after the age of 60, when metabolism often becomes slower and the body may become less sensitive to insulin. Rosemary contains natural plant compounds that may help the body respond better to insulin. Insulin is the hormone that helps move glucose from the blood into the cells, where it can be used as energy. When cells become resistant to insulin, sugar stays longer in the bloodstream. This can create stress on the body and increase the risk of metabolic problems. Some compounds found in rosemary may support this process by helping the body use glucose more efficiently. This does not mean rosemary tea is a treatment for diabetes. It does not replace medication, medical advice, or a healthy eating plan. But for people who are trying to improve their daily habits, rosemary tea may be a useful addition. A warm cup without sugar can replace sweet drinks, reduce unnecessary calories, and help create a calming routine after meals. This alone can make a difference. For seniors, the best approach is moderation. 1 cup a day may be enough for many people. It is also important to avoid adding too much honey, sugar, or syrup, because that can cancel the benefit. If you already take medication for diabetes, such as insulin or other blood sugar-lowering drugs, speak with a health professional before using rosemary tea regularly. Natural does not always mean harmless. When combined with medication, some herbs may strengthen the effect and increase the risk of low blood sugar. The real power of rosemary tea is not that it performs miracles. Its power is that it can become part of a daily routine that supports balance, discipline, hydration, and awareness of what you put into your body. 2. Rosemary tea may improve circulation and support heart health. Good circulation is one of the foundations of a healthy body. Blood carries oxygen, nutrients, hormones, and immune cells to every tissue. When circulation becomes weaker, the body may feel cold, heavy, tired, or slow to recover. After 60, many people begin to notice changes in circulation, especially in the hands, feet, legs, and brain. This is why rosemary tea is often discussed as a natural drink that may support blood flow. Rosemary contains antioxidant and anti-inflammatory compounds that may help protect blood vessels from oxidative stress. Oxidative stress happens when unstable molecules damage cells and tissues. Over time, this may affect the flexibility of blood vessels. When blood vessels remain more flexible, blood can move more easily, and the heart does not need to work as hard. Some traditional uses of rosemary include warming the body and stimulating circulation. A warm cup of rosemary tea may create a comforting effect, especially during colder days or when the body feels tense. Better circulation may also support clearer thinking, because the brain depends on steady oxygen delivery. However, this is where caution becomes very important. If someone has high blood pressure, low blood pressure, heart disease, kidney disease, or uses blood pressure medication, rosemary tea should not be used carelessly. Rosemary may influence circulation and may interact with certain medications. For some people, that may create unwanted effects. For example, if a person already takes medication to lower blood pressure, adding large amounts of rosemary could possibly strengthen the effect. Rosemary tea should be seen as a supportive habit, not a replacement for medical care. A healthy heart still needs physical activity, less processed food, enough sleep, stress control, and regular checkups. But when used wisely, rosemary tea can be one small part of a heart-friendly lifestyle. The most important rule is simple. Do not drink too much. More is not always better. One moderate cup can be helpful, but several strong cups every day may create problems, especially for people already dealing with health conditions. 3. Rosemary tea can calm digestive discomfort. Many people discover rosemary tea because of digestion. Bloating, gas, heaviness after meals, stomach discomfort, and slow digestion are common problems, especially after large meals or foods rich in fat. Rosemary has been used traditionally to support digestion because of its aromatic compounds and its ability to relax certain digestive muscles. When the digestive system becomes tense or irritated, cramps and discomfort may appear. Rosemary may help relax the smooth muscles of the digestive tract, which can reduce spasms and make digestion feel easier. This is one reason people often drink rosemary tea after eating. The warm liquid itself is soothing, and the rosemary aroma may also stimulate the digestive process. Another important point is bile. Bile helps the body digest fats. Rosemary may stimulate bile flow, which may support the breakdown of fatty foods. This is why some people feel lighter after drinking rosemary tea following a heavy meal. But this benefit also comes with a warning. People who have gallstones, especially symptomatic gallstones, should be careful. If rosemary increases bile movement, it may worsen symptoms or trigger discomfort in some cases. Rosemary also contains antimicrobial properties, meaning it may help limit the growth of certain unwanted microbes. A healthy gut depends on balance. The goal is not to destroy all bacteria, because many gut bacteria are helpful and necessary. The goal is to support a balanced environment where digestion works smoothly. If you often suffer from bloating, constipation, or abdominal discomfort, rosemary tea may be worth trying in small amounts. But if symptoms are severe, persistent, or accompanied by pain, bleeding, vomiting, fever, or unexplained weight loss, medical advice is necessary. Digestive symptoms can sometimes be signs of something more serious. For daily use, keep it simple. Drink rosemary tea after a meal, not too strong, and observe your body. If you feel better, continue moderately. If you feel nausea, pain, burning, or discomfort, stop and ask for professional guidance. 4. Rosemary tea may support memory, focus, and brain function. Rosemary has a long reputation as an herb connected with memory and concentration. Many people recognize its scent immediately, and some studies have explored how rosemary compounds may influence brain function. The brain is one of the most demanding organs in the body. It needs oxygen, nutrients, healthy blood flow, and protection from inflammation and oxidative stress. Rosemary contains compounds such as rosmarinic acid and carnosic acid, which are often discussed for their antioxidant properties. Antioxidants help protect cells from damage caused by oxidative stress. In the brain, this protection is especially important because brain cells are delicate and highly active. Some research suggests that rosemary may help support neurotransmitter activity. Neurotransmitters are chemical messengers that allow brain cells to communicate. When communication between brain cells works well, memory, attention, and mental clarity may improve. This does not mean rosemary tea can cure memory loss or prevent dementia by itself, but it may support a brain-healthy lifestyle. After 60, memory concerns become more common. Many people notice they forget names, enter a room and forget why, or need more time to concentrate. Sometimes this is normal aging. Sometimes it is related to poor sleep, stress, dehydration, medication, low physical activity, or nutritional deficiencies. Rosemary tea may help indirectly because it supports hydration, relaxation, and circulation. The aroma of rosemary may also play a role. Smell is strongly connected to the brain. A warm cup of rosemary tea can create a moment of focus and calm. This simple ritual may help the mind slow down and become more present. But again, expectations must be realistic. The best support for the brain includes regular movement, social connection, learning new things, good sleep, balanced meals, and management of blood pressure and blood sugar. Rosemary tea may be a helpful companion, not a magic solution. If memory problems are getting worse, affecting daily life, or creating confusion, it is important to seek medical advice early. Early evaluation can make a major difference. 5. Rosemary tea may reduce inflammation and support joint comfort. Inflammation is part of the body's natural defense system. When you get injured or infected, inflammation helps the body respond. But when inflammation becomes chronic, it can contribute to pain, stiffness, fatigue, and many age-related health problems. This is why anti-inflammatory foods and herbs receive so much attention. Rosemary contains natural compounds with anti-inflammatory activity. For people who experience joint stiffness, muscle discomfort, or general body aches, rosemary tea may provide gentle support. It is not a painkiller in the same way as medication, and it should not be presented as a cure for arthritis or other joint diseases. But as part of a balanced lifestyle, it may help reduce the daily burden of inflammation. Many people after 60 experience morning stiffness. The knees, hands, lower back, shoulders, or neck may feel tight when waking up. A warm drink like rosemary tea can help create a comforting start to the day. The heat relaxes the body, while the plant compounds may support a healthier inflammatory response. Rosemary is also used topically in some products, especially essential oil mixed with a carrier oil. Some people apply diluted rosemary oil to areas of discomfort. But essential oils are concentrated and can irritate the skin if used directly. They should never be applied to open wounds, burns, or sensitive skin without proper guidance. For tea, moderation is safer. 1 cup can be part of an anti-inflammatory routine that also includes vegetables, fruits, legumes, olive oil, fish, nuts, and reduced intake of processed foods. Movement is also essential. The joints need gentle activity to remain flexible. If you have strong pain, swelling, redness, or difficulty moving, do not rely only on herbs. Pain is a message from the body. Rosemary tea may support comfort, but it cannot replace diagnosis, treatment, or physical therapy when needed. 6. Rosemary tea may help the body handle stress and improve sleep quality. Stress affects nearly every system in the body. It can disturb digestion, raise blood pressure, increase cravings, tighten muscles, worsen sleep, and make the mind feel restless. Many people drink tea not only for its health properties, but also for the ritual. Preparing a warm cup, breathing in the aroma, sitting quietly, and drinking slowly can send a calming signal to the nervous system. Rosemary tea has a strong herbal scent that many people find refreshing and grounding. It may help reduce mental fatigue and create a sense of clarity. For some people, it is more energizing than relaxing, so timing matters. If rosemary tea makes you feel alert, drink it earlier in the day. If it calms you, it may be suitable in the evening. Poor sleep is common after 60. Some wake up several times during the night. Others fall asleep but wake too early. Stress, medications, pain, digestion, and blood sugar changes can all affect sleep. Rosemary tea may help indirectly by calming the digestive system and reducing tension after meals. But if taken too late or too strong, it may not suit everyone. A good evening routine is more than one drink. It includes reducing screen time, avoiding heavy meals late at night, keeping the room comfortable, and going to bed at a regular time. Rosemary tea can become part of this ritual if your body responds well. It is important to listen carefully to your body. Natural herbs can have different effects from one person to another. Some feel calm. Others may feel stomach discomfort or alertness. Start with a weak infusion and see how you feel. Stress should not be ignored, especially if it becomes constant. Chronic stress can affect the heart, immune system, and mental health. Rosemary tea may provide a peaceful moment, but serious anxiety, depression, or insomnia deserves professional attention. 7. Rosemary tea may strengthen natural defenses. The immune system protects the body every day. It fights viruses, bacteria, fungi, and other harmful invaders. As we age, immune function may become less efficient, which is why supporting the body's natural defenses becomes more important. Rosemary may help because it contains antioxidant, antimicrobial, and anti-inflammatory compounds. Antioxidants help reduce cellular stress. When the body is under too much oxidative stress, the immune system may become less balanced. Rosemary's plant compounds may support this balance. Its antimicrobial properties are also one reason rosemary has been used traditionally to preserve foods and protect them from spoilage. Drinking rosemary tea does not make the body invincible. It does not prevent every cold, infection, or disease, but it may support the body when combined with the basics that truly matter. These basics include enough protein, colorful fruits and vegetables, vitamin-rich foods, hydration, sleep, movement, and good hygiene. For seniors, immune support should be gentle and consistent. Extreme solutions are rarely the answer. A simple cup of rosemary tea can replace unhealthy drinks and increase daily fluid intake. Hydration alone is important for mucous membranes, digestion, kidney function, and temperature regulation. Another hidden benefit is that rosemary tea may encourage people to reduce excess sugar. Sugary drinks can affect blood sugar and weight. Replacing them with unsweetened herbal tea can support overall wellness. However, people with allergies should be careful. Rosemary can cause allergic reactions in some individuals, whether consumed or applied to the skin. Symptoms may include itching, rash, swelling, breathing difficulty, nausea, or digestive discomfort. If any unusual reaction appears, stop using it and seek medical advice. The immune system is not built in one day. It is supported by daily choices. Rosemary tea may be one of those small choices that helps the body stay more balanced. 8. Rosemary tea may support liver function and fat metabolism. The liver is one of the hardest working organs in the body. It processes nutrients, supports digestion, filters toxins, stores energy, and helps manage fats. Because modern diets often include processed foods, excess sugar, fried meals, and alcohol, many people worry about liver health, especially fatty liver. Rosemary has been studied for compounds that may support liver protection and fat metabolism. Some research suggests that rosemary may help reduce oxidative stress and inflammation in the liver. It may also support the way the body handles fats. This is why rosemary is often discussed in relation to fatty liver support. But it is very important to avoid exaggeration. Rosemary tea does not detox the liver in a magical way. The liver already detoxifies the body naturally. What rosemary may do is support the liver by providing antioxidant compounds and encouraging healthier habits. If someone drinks rosemary tea instead of sugary drinks, eats better, moves more, and reduces alcohol, the liver may benefit from the whole lifestyle. For people with diagnosed liver disease, medical advice is essential. Herbs can sometimes interact with medications or place extra demands on the body. A person with liver problems should not start concentrated supplements without guidance. Tea is usually gentler than capsules or extracts, but caution is still important. Rosemary can also be useful in cooking. Adding rosemary to meals may help reduce the need for too much salt or heavy sauces. Its strong flavor makes food satisfying without relying on unhealthy ingredients. When used in marinades, rosemary may also help reduce some harmful compounds produced when meat is cooked at very high temperatures. Still, the best choice is to avoid burning meat and to keep a balanced diet. Supporting the liver means supporting the entire body. Rosemary tea may help, but the real foundation is a clean routine, not an occasional miracle drink. 9. Rosemary tea may benefit skin, hair, and healthy aging. Skin and hair often reflect what is happening inside the body. Poor sleep, dehydration, stress, nutritional deficiencies, inflammation, and poor circulation can affect the skin's brightness and the hair's strength. Rosemary is popular in beauty routines because it contains antioxidant and antimicrobial compounds that may support healthy skin and scalp. When consumed as tea, rosemary may contribute antioxidants that help protect cells from oxidative stress. Oxidative stress is one of the factors involved in visible aging. It can affect skin elasticity, tone, and repair. Drinking rosemary tea will not erase wrinkles overnight, but it may support the body from within as part of a healthy lifestyle. Rosemary is also known for its traditional use in hair care. Many people use rosemary water or diluted rosemary oil on the scalp. Some studies have explored its potential role in supporting hair growth in certain cases, but topical use must be done carefully. Essential oil should always be diluted, and people with sensitive skin should test a small area first. It should not be applied to irritated skin, wounds, or burns. For seniors, skin becomes thinner and more sensitive with age. That means strong products and concentrated oils can cause irritation. Tea is often a gentler way to enjoy rosemary, but even tea should be used moderately. Hydration is another important factor. Many people do not drink enough water during the day. Herbal teas can help increase fluid intake. Better hydration may support skin moisture, digestion, and energy. If rosemary tea encourages you to drink more fluids without sugar, that alone can be useful. Hair and skin health also depend on protein, iron, zinc, vitamin D, healthy fats, and thyroid function. If hair loss is sudden, severe, or patchy, it is important to seek medical evaluation. Rosemary may support beauty routines, but it should not hide a deeper health problem. Healthy aging is not about looking young forever. It is about helping the body stay strong, nourished, and confident at every age. 10. Rosemary tea must be used correctly to avoid side effects. Now comes the part many people ignore. Rosemary may offer benefits, but it is not suitable for everyone in every amount. The same herb that may support digestion and circulation can also create problems when consumed excessively or combined with certain medications. A simple preparation is enough. Use 1 or 2 teaspoons of fresh or dried rosemary leaves for 1 standard cup of hot water. Pour boiling water over the leaves and let it steep for a few minutes. Then strain and drink. Some people add lemon, but avoid too much sugar or honey if your goal is health. You can drink it warm or cold, depending on your preference. For a stronger preparation, some people simmer rosemary in water for several minutes. This method creates a more intense taste and may extract more compounds. But stronger is not always better. If you are new to rosemary tea, begin with a light infusion. Observe how your body reacts. Drinking more than 2 cups a day may cause digestive discomfort in some people, including bloating, nausea, stomach pain, or vomiting. People with gallstones should be cautious because rosemary may stimulate bile flow. People with bleeding disorders, or those taking blood-thinning medication, should ask for professional advice before regular use. Rosemary may also interact with blood pressure medication, water pills, and diabetes medication. Pregnant and breastfeeding women should avoid using rosemary in medicinal amounts unless advised by a qualified professional. The amount used as a seasoning in food is different from drinking strong teas, extracts, or supplements. The safest rule is this: use rosemary tea as a supportive habit, not as a treatment. Keep the amount moderate. Do not replace prescribed medication. Do not ignore symptoms. And if you have a chronic condition or take regular medication, ask before making it a daily routine. If this information helped you, share it with someone who drinks herbal teas without knowing their effects. And remember, the most powerful health changes often begin with small daily choices. A cup of rosemary tea may seem simple, but when used wisely, it can become part of a stronger, calmer, and more balanced lifestyle.